Ear keloid. What exactly is a keloid? Many a times you might have seen that after you get ear piercing, there's a huge swelling in some individuals which develop. It usually happens after an infected ear piercing or in certain individuals of certain genetic race in which they have a tendency of developing hypertrophic scars and keloids. So keloid is a medical condition in which while healing, our body does not heal properly, and the healing process which should stop once the skin has closed does not stop, and the healing or the tissue growth keeps happening, and a swelling develops, very itchy, hard, grows out of the margins of the wound. So today we are discussing a few cases of ear keloid because that is one of the very common presentation of keloid that happens to come to me, and we treat such cases very frequently. So if I talk about the treatment options for keloid, there are 4 or 5 different treatment options that are usually practiced. In the very initial stages, when the keloid is just developing, or if there is any swelling that is happening, if you find a very hard swelling developing in your ear piercing area, or if there is a lot of itching, what you can do is you can show a plastic surgeon and he can recommend you pressure clips. So when pressure is applied to such lesions, it usually delays healing, and so the healing process is usually diminished and it stops and the keloid is not formed. If it is a bit more, the doctor may advise you certain injections, and these injections are given within the keloid, which usually causes atrophy, and the size of the keloid might decrease. But once the size of the keloid is too big for an injection or pressure therapy, then the only treatment modality that remains is surgically removing the keloid and then doing these things. So one must always remember that keloid can happen again, but if you take proper precautions, if you take proper pressure therapy, proper treatment of the infection and all, it is very likely that it won't happen. Even if it is happening at the initial stage only, if you go and see your doctor, he'll advise you to get an injection done, and that will atrophy the size of the scar that is being formed, and it will get back to a normal shape. So here I am showing you a few results of patients. So this patient, she had a piercing done in her upper ear, and she developed a keloid in the upper ear, and we take care not to injure anything outside the margins of the keloid, and we do an intralesional excision of the keloid. We stitch it, and the stitches are usually removed after 5 to 7 days, and then after about 15 to 20 days I advise them to wear pressure clips, and these pressure clips, they give compression to the site, reduces the chances of recurrence of the keloid, and if it happens again, you have to come back and get a injection which is Kinacot into the keloid, which will reduce the reformation. So here I am showing you another patient who has a keloid in the most common area, that is the earlobe, and we have removed this keloid, and this is his result after about 1 month. Again another patient in which she has a huge keloid and the whole of the earlobe is now deformed, and we have tried to recreate her earlobe to as normal as possible, and that is why I always recommend you see a plastic surgeon at an early stage before it goes to a very deformed position in which the cartilage and the other structures are involved, and the shape is so much deformed that it is very difficult to get back to a normal shape. This is another patient in which there is a completely deformed shape of the ear, and this was because she got piercings and then got infected and was treated by a local practitioner. She did not take care proper, and then huge keloids developed, did not take care to get them removed at an early stage, and this is what we could achieve in her 1 stage, and gradually we can give her an even better shape. This is another patient who had a simple case of keloid, and we removed her keloid, a small keloid, stitched it, and this is how she looks, absolutely normal. So these are the few cases. These are some depictions in how you should not be very much worried about a keloid, but few things you always need to keep in mind. That whenever you get your ear piercings done, get it done by a doctor, or wherever you are getting it done, make sure that the instruments are sterile. There is less chance of infection, because if it gets infected, the chances of forming a keloid is more, and it's a treatable condition. You might need a bit follow-up, but yes, with proper follow-up and proper care, it's very much treatable and you can get back the normal shape. Thank you.